Welcome to my YouTube channel, Everything Medical. Today's video, we shall be appreciating the uterus, the anatomy of the uterus, right? If you are coming across to this channel for the first time, do not forget to subscribe, like, comment, and share our video, right? It is so essential so that other students can see it and benefit from the teachings. Now let's proceed. Let's dive into the class properly. All these diagrams are what we shall be using to appreciate the anatomy of the uterus, that is the womb, right? So the first thing first is the introduction. What is uterus? And uterus is a hollowed, thick-walled, firm, child-bearing organ of females. It is a hollowed, thick-walled, firm, child-bearing organ of females. The uterus can be called womb in the layman's understanding. The layman's understanding, the concept or the name of uterus simply means womb. That is what you are seeing here. It can be referred as the womb, although it can also be called the hysteria. That is why the surgical removal of uterus is known as hysterectomy. So it can also be called hysteria. Right? You have to understand that the uterus provides, it protects and provides nutrition for the fertilized oocyte, enabling it to grow into a fetus. Right? During childbirth, that is parturition. The contractility or the contraction of the uterine smooth muscles result to the expulsion of the fetus from the uterus, right? To tell you that the smooth muscles of the uterus is so essential for parturition, that is delivery, to take place, because they have to contract so that they will expel the fetus from the uterus, that is the womb, where the baby is fully developed or formed, right? So that is the concept of the uterus. You have to understand again that the uterus is usually palpated during bimanual per-vaginal examination, that is PV vaginal examination. That is PV examination, right? So the uterus is usually palpated during bimanual PV examination, that is per-vaginal examination. So those are the concepts of the uterus. It is a childbearing organ in female, right? The uterus is situated on the pelvic region. It is situated on the pelvis between the urinary bladder and the rectum. That is where the uterus is situated. It is situated on the pelvis between the urinary bladder and the rectum. So those are the concepts of the uterus, right? Now, the next outline we shall be looking onto is the size and the shape. The size and the shape. The uterus is pyriform in shape. It is pyriform in shape. Pyriform. It is pyriform in shape. The length of the uterus is usually, 7.5 cm in length, while it is 5 cm in broad. And it is also 2.5 cm in thickness. So these are the size of the uterus. It is 7.5 cm in length. It is 5 cm in broad, that is the size, it is 2.5 cm in thickness. The uterus is divided into upper expanded part, which is known as the body, and the lower cylindrical part, which is known as the cervix. Now what? This diagram here depicts the physical features of the uterus, right? We said that it is divided into upper expanded part, which is the body. So from here to this region is the body. Body of the uterus. Why? From this region to this region is the cervix, which is the lower cylindrical part. Right? Now, the junction between the two parts of the uterus, which is the body and the cervix, is marked or indicated by a circular constriction called the isthmus. This is the isthmus of the uterus. Isthmus of uterus. Right? Recall that there is a part called the fundus. The fundus is the part of the uterus that is located above the two openings of the uterine tube or the fallopian tube, right? So this is the fundus. The fundus of the uterus, you can see that it is located above, between the two openings of the fallopian tube or the uterine tube. This is the fallopian tube, right? The fallopian tube. Fallopian tube or the uterine tube, right? Uterine tube. As we proceed, we'll discuss these various regions, right? Now, the body of the uterus is the largest part. It forms 2/3 of the uterus, while the cervix forms the 1/3 of the uterus. You can see that the body is more larger compared to the cervix, right? The body is more larger compared to the cervix. Why? The junction between the two parts, which is the body and the cervix, is marked by a circular constriction called the isthmus of the uterus. Now, this remains the ovary. Ovary, right? This is the ovarian fimbria. Why this is the infundibulum of the fallopian tube. Infundibulum of fallopian tube. This is the ampulla of fallopian tube where fertilization occurs, and is the most largest part of the fallopian tube. Ampulla of fallopian tube. Right here is the isthmus of the fallopian tube. The isthmus. Of fallopian tube. Isthmus of fallopian tube. So this is how the size and the shape of the uterus is fashioned, right? As we proceed, we get to label other part of this beautiful uterus. It is a cherishable and a treasure in a female body. This is the uterus. Now, the next outline we shall be discussing is the normal position and the angulation of the uterus, right? Position and Angulation, that is the angles of the uterus. This diagram here depicts the angulation and the position of the uterus, right? You have to understand that the uterus is not vertically lined with the vagina, right? It is not. It creates an angle. It creates an angle, right? As we proceed, we get to know the angle that it creates as it is being situated on the pelvis. Now, the first thing to note is the long axis of the vagina and the long axis of the uterus, and also the long axis of the cervix. This dotted line denotes the long axis of the vagina. While this denotes the long axis of the cervix. While this denotes the long axis of the uterus. Right? This remains our pubic symphysis. This remains our urinary bladder. This remains our vagina. Right? This remains our uterus. Now, let's begin with the angle. There are two angles here. In fact, there are three angles, right? But one is not seen anteriorly. Now, the long axis of the uterus forms an angle 90 degrees with the long axis of the vagina. You can see it here. The long axis of the vagina form an angle 90 degrees with the long axis of the uterus, particularly at this region. So here is the angle 90 degree. Angle 90 degrees. The angle is usually forward. It is usually forward, right? The angle usually, you can see that there is an angle here. That is why the vagina and the uterus are not in a vertical placement, right? They are not vertically placed. They create an angle, right? So the first thing is angle 90, which is being formed by the long axis of the uterus with the long axis of the vagina. The angle are usually forward, right? Now, the forward bending of the uterus relative to the vagina create what we call anteversion. It creates what we call anteversion. Anteversion. While the backward bending of the uterus relative to the vagina create what we call retroversion. Retroversion. But you have to understand that the uterus is usually slightly flexed. It is usually slightly flexed at the level of the external os of the cervix, right? And when it is that's slightly flexed at the level of the external os of the cervix, I mean at the level of the internal os of the cervix, not the external os, the uterus is usually slightly flexed at the level of the internal os of the cervix. And when it is flexed, it creates an angle. Angle 125 degrees. Look at it here. 125 degrees. The angle is here. So it is the slightly flexion of the uterus at the level of the internal os of the cervix create an angle of 125 degrees. And that angle is called anteflexion. 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 Look at it here. At this region, angle 125 degrees. 125 degrees. So this is how the angulations of the uterus is fashioned. There is a label here. Shallow posterior fornix of vagina. Deep anterior fornix of vagina. Right? Recall that this angle 90 is also called the angle of antiversion, right? While angle 125 degrees is also called angle of antiflexion because it was created as a result of the slight flexion of the uterus at the level of the internal os of the cervix, right? You can see it here. Angle 125 degrees can be called angle of antiflexion, while angle 90 degrees can be called angle of antiversion. So that is how the angles of the uterus is fashioned. That is, the angulation of the uterus is fashioned, right? The next we shall be discussing is the communication. How does the uterus communicate? It has two communicating patterns. One is superior, two is inferior. Superiorly, it communicates with the two uterine tube that is on each side of the uterine tube of the uterus. Now you can see it here. Superiorly, it communicates with the right and left uterine tubes. That is the communication, the superior communication. While inferior communication, it communicates with the vagina. So this is the vagina. Vagina, right? Here is the myometrium. Here is the endometrium. That is the endometrium. So those are the communication of the uterus, right? The next outline we shall be discussing is the part of the uterus. The part. The uterus has the following parts. We have the fundus, though we have touched it earlier on. The fundus, the body. The body of the uterus is divided into two surfaces. We have the anterior surface or the visceral surface, the posterior surface or the intestinal surface or the intestine surface, whichever one. We have two lateral borders. So these are the parts of the uterus. Now watch here. Watch this region. We have the fundus. Here is the fundus. The fundus of the uterus. This is the fundus. Right? The fundus of the uterus is the free upper end of the uterus. You can see it is the free upper end of the uterus. Right? And it is located or lie above the two opening of the uterine tube, which is this. It is being covered by the peritoneum, particularly the serous peritoneum. right? The serous peritoneum covers it. It is being covered by the peritoneum, which is serous peritoneum that covers it. The fundus of the uterus is so essential, right? It's so essential because the fertilized oocyte usually get implanted on its posterior wall. It usually get implanted on the posterior wall. That means implantation of the fertilized oocyte usually get embedded on the posterior wall of the fundus of the uterus. You tell you that it's so essential as being part of the uterus, right? So that is how the fundus of the uterus is being fashioned. Also, the fundus of the uterus is convex. It is convex like a dome. You can see it. It is convex like a dome. It is convex like a dome. That is why it is convex, right? So let's quickly look at the body. The body has two surfaces. We have the anterior surface or the visceral surface and the posterior surface or the intestinal surface. Anterior surface or visceral surface, we have posterior surface or intestinal surface. Now, the anterior or visceral surface is flat. It is usually flat and it is related to the what? Urinary bladder. It is also being covered by the peritoneum, right? It forms the posterior or the superior wall of the uteroviscal pouch, right? Uteroviscal pouch. Uteroviscal pouch. That is what that forms it, the anterior or the visceral surface of the body of the uterus, right? While the posterior surface of the body of uterus is convex. It is convex and it is related to the coils of the intestine and the rectum, right? It is related to the coils of the intestines and the rectum, right? It is also being covered by the peritoneum. It forms the anterior wall of the recto-uterine pouch. Recto-uterine pouch. Recto-uterine pouch. So that is all about the anterior and the posterior surface of the body of the uterus. The anterior surface is usually flat, while the posterior surface is usually convex, right? This forms the anterior wall of the recto-uterine pouch, while anterior surface forms the posterior or the superior wall of the uteroviscal pouch. Now, let's quickly look at the two borders. Each of these two lateral borders is convex and rounded. It's usually convex and rounded, and it provides site of attachment of the broad ligament of the uterus, which attaches the uterus to the lateral pelvic wall. So that is the information or what the two lateral borders of the body of uterus is fashioned, right? It is round and what? And convex. So that is all about the parts of the uterus. Because that this remains the uterine cavity. Uterine cavity, right? The next outline we shall be discussing is the cervix of uterus. The cervix of uterus is the lower cylindrical part of the uterus. It is the lower cylindrical part of the uterus. it is 2.5 cm in length, and it is more lesser in width compared to the body of the uterus. You can see the body of the uterus is bigger compared to the cervix. So the cervix is lesser compared to the body of the uterus. Also, the cervix of the uterus is so essential that it is wider on its middle part, compared to the both end, because it has an end, right? Now, the lower part of the cervix project into the anterior wall of the vagina to create two parts called the supravaginal part and the vaginal part. Now watch. This is the supravaginal part. Here is the supravaginal part. Supravaginal part. While here, this region is the vaginal part. Vaginal part. Recall that the cervix of the uterus forms the lower 1/3 of the uterus, which we have said previously when we started this class. Now, the supravaginal part has boundaries. Anteriorly, it is bounded by the urinary bladder. Posteriorly, it is bounded by the recto-uterine pouch, which contains the course of the intestine and the rectum. Now, on the both sides, it is related to the ureter and also uterine artery that is embedded on the parametrum. So that is all about the supravaginal part. Now, the vaginal part projects into the anterior wall of the vagina. Now, in between this anterior wall of the vagina and the vagina, it creates a space called the vaginal fornix. Fornix, the vaginal fornix. Look at it here. This is the vaginal fornix. Vaginal fornix. Look at two of them, right and left, what vaginal fornix. Now, the cervical canal usually open into the vagina through an opening called the external os. The external os, right? This is the external os. Here is the external os. External os of the vagina, because the cervical canal, this is the cervical canal. Here, from here, like this, is the cervical canal. Cervical canal. So the cervical canal open into the vagina through an opening called the external os. Now you have to understand that the external os in nulliparous women, that is a woman that has not given birth, usually small and circular. In nulliparous women, that women have not given birth, nulliparous. The external os of nulliparous women is usually small and circular, while the external os of multiparous women is usually bounded by the anterior and posterior lip, which occupies the posterior wall of the vagina. So we have nulliparous and multiparous. Multiparous. Nulliparous is women that have not given any birth, while multiparous is women that have given birth. So the external os is quite different, right? So here is our internal os. This is the internal os, right? Internal os of the vagina, right? So what is cervical canal? Cervical canal. The cervical canal is the cavity of the cervix. It is the cavity of the cervix. Look at it here. It is the cavity of the cervix, right? It is the cavity of the cervix, which communicates to the body of the uterus through the internal os, and also to the body of, and also to the vaginal cavity through the external os, right? The cervical canal, which is the cavity of the uterus, the cavity of the cervix, communicates to the body cavity, that is the cavity of the body of the uterus, through the internal os, and also communicates to the cavity of the vagina through the external os. You can see the two ends, internal os and external os. This is the cervical canal, which is the cavity of the cervix, because here is the cervix, right? Let's quickly discuss the next thing we have. Perineal body. This diagram here depicts the perineal body, right? And this is the perineal body. The perineal body is a fibromuscular node in which 10 muscles are attached. It is a fibromuscular node in which 10 muscles are attached. It acts as an anchor to the pelvic diaphragm, right? It also maintains the integrity of the pelvic floors, where we have the pelvic floor muscles. Those 10 muscles is maintained by the perineal body, right? And when the perineal body is damage to the perineal body leads to the prolapse of the uterus and also the pelvic organs, right? To tell you that it is one of those structure that provides support to the pelvic organs. So lesion or damage to the perineal body will lead to the prolapse of the uterus and also to the pelvic organs. So this is the urethra. This is the vagina. This is the anal canal. The anal canal. While this is the iliococcygeus muscle. Iliococcygeus muscle. While this is the pubococcygeus muscle. That is one of those muscles that attaches on the perineal body. Pubococcygeus muscle. Pubococcygeus muscle. You can see they are of different layers. So let's quickly discuss the ligaments. The ligaments. The uterus has the perineal ligament and the fibromuscular ligament. The perineal ligament, you have perineal ligament and fibromuscular ligament. The perineal ligament of the uterus are those ligaments that does not support the uterus. They are just like the fold of the perineum. That is why we have the anterior ligament, which consists the uteroviscal fold of the peritoneum, is a peritoneal ligament. While we also have the posterior ligament, which consists the recto-uterine fold of the peritoneum, right? We also have the anterior and lateral broad ligament, right, which helps to anchor the uterus on the lateral wall, on the lateral pelvic wall, right? So those are just like an accessory ligament. They do not support the uterus. They are just like folds of the peritoneum, right? That is why we have the anterior, posterior, and also right and left broad ligament. All of them are the peritoneal ligament. Now, the fibromuscular ligament, they are the major one that support the uterus to keep it in place, right? We have the transverse cervical ligament. We also have the uterosacral ligament. We also have the broad ligament of the uterus. Now, watch. This is the ovary. Here is the fimbria. The fimbria. This is the uterine tube. Uterine tube. Here is the uterus. Uterus. This is the ligament of ovary. Ligament of ovary. This is the cervix. The cervix. Here is the vagina. This is the urinary bladder. Urinary bladder. This region here, this is the uterine artery. Uterine artery. This is the left uterine tube. Left uterine tube. This is the round ligament of the uterus. Round ligament of uterus. Round ligament of uterus. Why this is also the round ligament of uterus? Two of them. Why this a whole is the broad ligament of uterus, right? All of them here and here, all of them here, like this line is the broad ligament of uterus. Broad ligament of uterus. This is the posterior layer of broad ligament of uterus. Posterior layer of broad ligament of uterus. Why this is the anterior layer of broad ligament of uterus, right? Because the broad ligament of uterus consists of plenty things. It consists of the uterine tube, it consists of the round ligament of uterus, it also consists of the uterine vessel which attaches on the uterus or near the attachment of the uterus. It also consists of some lymph nodes and lymph vessels. It also consists of the ovarian vessel on the infundibulopelvic ligament. It also consists of parophorone and epophorone. So all these things I just mentioned are the structure that is found in the broad ligament of the uterus, which is being supplied by the uterine arteries, right? So that is all about all this diagram consisting of the ligament of the uterus. The broad ligament of the uterus is so essential, right? That is one of the first cardinal ligaments of the uterus. Now, let's quickly look into next outline, which is the blood supply. The blood supply of the uterus is chiefly supplied by the uterine artery. Uterine artery, which is an anterior division of the internal iliac artery. It's also being supplied by the ovarian artery, which is partly supplied by the ovarian artery. This is the chief one, chiefly supplied by uterine artery and partly supplied by the ovarian artery. Ovarian artery. Now, as the uterine artery comes from the anterior division of the internal iliac artery, once it gets to the ovary with an anastomosis with the ovarian artery, so that is how it works. And also, this uterine artery also supplies to the vagina. It also supplies to the medial two-thirds of the uterus. It also supplies to the ovary. It also supplies to some of the structures in the broad ligament of the uterus, right? I said it here. Broad ligament of uterus is a so and very essential ligament, right? Now, the next one is the nerve supply. The nerve supply of the uterus is both sympathetic and parasympathetic, which is derived from the inferior iliohypogastric and ovarian plexus, right? They are being derived from the inferior iliohypogastric and ovarian plexus, right? Now, the sympathetic fibers is coming from the T12 to L1 spinal segment, which is responsible for uterine contraction and vasoconstriction, right? While the parasympathetic fibers is coming from S2 to S4 spinal segment, right? Which is mainly responsible for vasodilation and initiation of the uterus. So that is all about the nerve supply. It is both sympathetic and parasympathetic. For sympathetic is from T12 to L1. T12 to L1. T12 to L1. While parasympathetic is from S2 to S4 spinal segment, right? So that is how it works. Let's look at the lymphatic drainage. Lymphatic drainage. Lymphatic drainage is mainly being drained by an interconnecting lymphatic network, which is the myometrial, endometrial, and subperitoneal lymph plexus. We divide it into upper lymphatics and lower lymphatics. The upper lymphatics is mainly by the aortic lymph node, while the lower lymphatics is formed by the superficial inguinal lymph node, the internal iliac lymph node, the external iliac lymph node, and also sacral lymph node. So those are the lymph node that drains on the uterus, right? The venous drainage. The venous drainage is mainly drained by the uterine vein and also ovarian veins, right? So that is all about the venous drainage. Now let's look at the clinical correlation. The clinical correlation of the uterus. It is so essential that you know the clinical correlation of the uterus. The clinical correlation clinical correlation. Number one is that we have posterior colpotomy. Posterior colpotomy. Posterior colpotomy is usually a clinical procedure that is employed to drain pus on the pouch of Douglas, right? Posterior colpotomy is a clinical procedure that is derived or employed to drain pus on the pouch of Douglas. Number two is the intrauterine contraceptive. Intrauterine contraceptive is used to prevent pregnancy, thereby preventing the implantation of the fertilized oocyte on the posterior wall of the fundus of the body of uterus, right? Number three clinical correlation is the uterine fibroid, which is the leiomyoma, right? Because the uterus is the commonest site for the occurrence of the fibroid, that is the uterine fibroid. That's benign growths on that usually occur on the uterus, right? Number four is in respect to the perineal body, right? Because lesion to the perineal body or damage to the perineal body usually leads to the prolapse of the uterus and other pelvic organs, right? Because the perineal body is one of those chief support of the pelvic organ and also the uterus. So lesion to the perineal body will lead to the prolapse of the uterus and other pelvic organ. So I believe we have done justice to the anatomy of the uterus, ranging from its clinical correlation to the introduction to the clinical correlation. Our body is too small. We are going to get a bigger board that will draw big diagrams and detail our explanation. Thank you so much for staying to the end of this class. I really appreciate it.